Welcome back. If a good night's sleep is something that you haven't had in a long time, it may be time to ask yourself, is sleep apnea ruining my life without me realizing it? Well, Dr. Suzanne is here to talk about the dangers of sleep apnea. Doctor, thanks for being here.
Well, thank you so much for having me.
It's a pleasure. So this is a condition that maybe a lot of people have no idea they're living with.
They have no idea. There's 22 million American adults that have it, but 85% of those people have no idea that they do. And what obstructive sleep apnea is, it's where you're gasping, choking, and you're suffocating your sleep. You stop breathing while you're sleeping. And so it's, like I said, it's such a serious condition, but people aren't aware that they have it. My best friend's father actually had a heart attack from it. And then my assistant's 21-year-old cousin died from sleep apnea, and he had no idea he had it. So it's so important to bring awareness. And I just want to see if you or your audience has sleep apnea. So let's take the quiz.
Let's do it.
All right, question number 1. Do you get drowsy or doze off while you're sitting and reading, or maybe watching TV, or sitting in a public place like a theater or a meeting, or maybe while stopped at a stoplight or a stop sign, which could be extremely dangerous?
Right, while you're driving.
Yes. Question number 2. Now, do you snore? You know, ask your bed partner or record yourself at night to see if you snore, because if you do, you definitely could be at risk. That's one of the biggest signs of sleep apnea. Question number 3, do you wake up feeling refreshed, or do you wake up tired every day, even though you thought you slept for 6 to 8 hours? Question number 4, Alex, are you tired all of the time? Question number 5, do you have frequent headaches, or do you grind your teeth? Question number 6, do you have depression or mood swings? I mean, you don't seem like you're depressed at all. You're good. Question number 7, are you gaining weight no matter how hard you diet and exercise? Question number 8, do you have diabetes or high blood pressure? And last, question number 9, do you have heart disease? You know, if you've said yes to any one of those questions, there's a chance that you could have sleep apnea and you may not even know it. 2 yeses, it's very likely that you could. Answer yes to 3 or more of those questions, well, we better get you tested, because the chance of you having sleep apnea is extremely high. So there are 2 ways, 2 options you can have. You've got to do a sleep study. You could go into the hospital or sleep lab, be strapped to a bunch of electrodes, and have someone watch you while you sleep.
Which is hard to do. I mean, I've heard a lot of people do that type of test. It's hard to get asleep, of course, to go to sleep, but there's at-home tests now too, right?
Yes, and that's exactly what I have here. This is my Aries home sleep test device. And it's so simple. You take it home, you get to sleep in the comfort of your own bed with no electrodes, no stranger watching you, and it will collect data overnight. Then you bring it back in for analysis, and a board-certified sleep physician will read the results and tell you whether or not you have sleep apnea.
And there's different levels of sleep apnea too, right?
Absolutely. There's mild, moderate, severe. And so with that being said, there's different treatment options. And so if we find out you have sleep apnea, you can be like Shaquille O'Neal and William Shatner. They all have sleep apnea, and they use a CPAP machine. So this is an example of one of the masks that's connected to the CPAP machine, and it goes over your face. Well, let's see if we want to try this.
You might as well.
We might as well.
Look
Let's
like
see.
Darth Vader for a second.
Look,
It'll be fine.
see
there
how
it is.
But it will give you continuous airflow and help you breathe. And so I know it looks a little scary, but it's better to look a little scary than
Right,
die.
and survive through the night, certainly. And CPAP stands for what
Continuous
exactly?
positive airway pressure. So
Got
it just
it.
gives you continuous air, and it comes in different types, different styles, but this is one example.
Right.
But then we also have the option of an oral appliance. This little dental device takes the place of a CPAP machine. It's perfect for CPAP intolerant patients because if you see, it's small, it's comfortable, it's convenient. You can take it anywhere you go. Patients who are consistently traveling, they love this because, they don't want to lug the CPAP mask with the straps and everything like that. So they can take this with them, and it's honestly one of my favorite treatment options that my patients love.
Well, and we all remember wearing retainers. If we had braces, it's just similar to that. Real quick before we go, tell us about your book.
Yes, my book. So my book is A Patient's Guide to Sleep Apnea. It's called Snoring, the Clue That Can Save Your Life. And ultimately what it is because snoring is one of the biggest signs, but it just gives you signs, symptoms, treatment options, patients' testimonials, how it's helped their life, and ultimately just how to save their life.
Dr. Suzanne Tai, you wrapped it all up in a bow for us. It's very easy to understand the way you put it. If people feel any of those symptoms, they certainly should check with their doctor because it can be life-threatening. So thank you so much for joining us.
Thank you so much for having me. Thank you.
Nice
all
to
right,
see you.
Nice to see you too.
Now you can find Dr. Tai's book, Snoring, The Clue That Can Save Your Life, on Amazon. And to learn more about anything else we discussed, please visit SuzanneTai.com or call 940-312-6939.